Good afternoon, everyone. My name is Sarah, and today I'm going to talk about Chapter 15, Disorders of Childhood and Adolescence, focusing specifically in neurodevelopmental disorders. These conditions usually appear in early age and affect how a child thinks, learns, behaves, and interacts with the world. What are neurodevelopmental disorders? Neurodevelopmental disorders are conditions that begin during the developmental period, usually before school age, and they involve difficulties in areas such as thinking, learning, behavior, communication, social interaction, emotional regulation, and daily living skills. These disorders can continue into adolescence and adulthood, and the main ones are intellectual disability, autism spectrum disorder, ADHD, specific learning disorders, communication disorders, and motor disorders. So, what is intellectual disability? The intellectual disability involves limitations in intellectual functioning, such as reasoning, learning, and problem solving, and limitations in adaptive functioning. Symptoms begin during childhood. The areas affected are academic learning, communication, social judgment, independence skills, and safety awareness. On the other hand, we have possible causes. What causes this disorder? It could be genetic conditions like Fragile X syndrome or Down syndrome, or it could be birth complications or childhood illnesses or injuries. So Sarah, what's the treatment for that disorder? Well, they could go to special education services or go to early intervention programs or speech, occupational, and behavioral therapies, and the most important for me and for them, family and community support. Alright, we finished the intellectual disorder. Now let's see what autism spectrum disorder is. Children with this disorder often have trouble with back and forth conversation. Also, they have difficulty reading facial expressions or social cues, and they have limited eye contact. They also have repetitive movements, intense focus on a specific interest, and they need a specific routine every day. On the other hand, the factors or causes for this disorder is strong genetic component, differences in brain development, and is not caused by vaccines, as people may think. There is several treatments for this disorder, like speech therapy, occupational therapy, social skills training, sensory integration therapies, and the most important one, applied behavior analysis. Okay, let's go ahead and talk about attention deficit and hyperactivity disorder, well known as ADHD. There's 3 types of ADHD. The first one is inattentive type. The second one is hyperactive impulsive type. And the third one is combined type. Common symptoms for these ones are difficulty paying attention, trouble staying organized, interrupting others, acting without thinking, and forgetfulness. What are the causes or the factors? There's differences in dopamine regulation, genetic factors, and prenatal risk. For this specific disorder, there's different treatments. One of the most important things is time management and organizational strategies, as well as stimulant medications or behavioral therapy or classrooms accommodations. Let's move on with specific learning disorders. These disorders affect academic skills despite normal intelligence, such as dyslexia, that are problems with reading and word recognition. The other one is dyscalculia, problems with math skills, and dysgraphia, problems with writing. The causes are genetic influences and differences in how the brain processes information. The treatment is based on individualized instruction, extra time on assignments or tests, multisensory learning methods, and specialized reading or math interventions. Well, let's do a pause here. Just wanted to say I hope you're enjoying this video. Don't forget to like and subscribe to our channel for all psychology lovers. Alright, let's keep going with communication disorders. This includes language disorder, there is difficulty with vocabulary, grammar, or sentence structure. Then there's a speech sound disorder, that is problem producing certain sounds correctly. Then is childhood onset fluency disorder, that is interruptions in the flow of speech. And finally, social pragmatic communication disorder, and is a difficulty using language appropriately in social situations. For all these disorders, we could use the same treatment, such as speech language therapy, social communication practice, and parent and teacher support. And last but not least, motor disorders. These ones include developmental coordination disorder, basically is poor coordination, clumsiness, and difficulty with fine motor tasks. Moreover, we have tic disorder and Tourette syndrome. This consists in sudden, rapid, repetitive movements or vocalizations. Tics get worse with stress or excitement. Treatment consists in occupational therapy, habit reversal training, a form of CBT, and medications in severe cases. Let's quickly go over the risk and protective factors related to neurodevelopmental disorders. There are risk factors and there are protective factors. Risk factors include things like exposure to substances during pregnancy, birth complications, environmental toxins, genetic vulnerabilities, and long-term stress or poverty. This increases the chances of developmental difficulties. On the other hand, we have protective factors such as a stable and supporting home, early diagnosis, early intervention services, access to therapy and educational support, and positive relationships with caregivers. These protective factors can make a huge difference in how a child develops and adapts. Thanks for watching, and I hope to see you next video.